Awareness is the first step towards prevention. Together, let's share knowledge, let's create awareness, let's encourage early checkups and screening so that we can help those people who are fighting different conditions like cancers in our society today. My name is Charles Willis, and in this today's podcast, I'm going to talk about cancer, what it is, generally some of the management programs that have been developed to manage cancer. Generally, your body is made up of cells. These cells are what comes together to form tissues, and tissues will later form different organs in your body. That's when put together form your entire body. So in a cell, we have what we call DNA, and this DNA is what contains the genetic information that controls all this entire process. So this entire process of cell division is normally controlled on where it starts and how it stopped. So when this DNA is infected, maybe with different chemicals from the environment called carcinogens, when it is damaged, then it undergoes what we call mutation. It mutates, and when it mutates, your cells will start to divide abnormally. It now fails to follow the programmed and the normal process and start to divide abnormally. The cells start to grow in an uncontrolled manner without stop. Your normal cells will always divide, and at some point the cells will stop, or the cells will undergo what we call apoptosis, a programmed cell death, just to maintain the uniformity of your appearance in different tissues and organs. But when this DNA has been infected with different chemical viruses, maybe radiations from the environment, then it mutates, and this entire process is interfered with, leading to abnormal cell growth. So this abnormality in cell growth normally doesn't follow the usual process of cell division, and that is what will lead into development of tumors, where the cells just grows abnormally without stop, becoming big and large, forming what is known as tumors. And these tumors tend to behave in a similar manner just like your normal cells. The only difference is it has gone rogue and abnormal, it can't be controlled. And it also forms its own blood supply to sustain its growth. So it is connected to your body's blood supply that provides it with the necessary nutrients and everything to sustain its growth. These tumors are what, if are not detected early enough and managed, then they develop to what we call cancers. So the tumors can either be a benign, or a benign, this is that one that has not developed into cancer, but a malignant one is the one that has developed into a cancer and can easily spread into different parts of the body, process known as metastasis. So that is generally what cancer is. It arises as a result of some genetic mutation that disrupt the normal cell function. And remember, the mutation arises from the DNA being infected by viruses or infections, by chemicals, by radiation, things like that. And these things are families. So if you check at all these things, chemical, radiations, infections, we are all exposed to cancer. That simply means we are all at risk of getting cancer. So there are normally different types of cancers that we have. So the cancer can be a solid tumor, or it can affect your blood. So in the solid tumors, we normally refer to them as either carcinomas or sarcomas. They are those that affect your bone, your muscles, and your connective tissues. So those are the solid tumors, the sarcomas and carcinomas. And in the blood, they can either refer to them as leukemias, that if they affect your blood and the bone marrow, or the lymphomas, that is if they affect your lymphatic system. Here the doctor said that maybe you are developing acute myeloid leukemia, or maybe chronic lymphoma. Such terms, you normally come across them in the hospital. So the major types of cancer, we have the solid ones and the one that affects blood. For the solid one, we have the carcinomas. The carcinomas one are the ones for the skin, lungs, breast, colon, and different organs of the body. And for the sarcomas are the ones that affect your bone, muscles, and your connective tissues. So cancer normally develops silently within your body, very silent, and after a period of time, can take 2 years, 3 years, 4 years, 1 year, is when you can start to feel the symptoms. That's why it is very important for early screening and checkup so that you can detect them early enough that can be managed or eradicated completely. Because if you start feeling the symptom like it has developed greatly, then it will be difficult to eradicate it completely. So it normally comes with some symptoms like unexplained weight loss, persistent fatigue, chronic pain, lumps, swelling, abnormal bleeding, persistent cough, change in bowel. Some of the symptoms that are maybe similar to other conditions. But sometimes you find that you have tested all these other conditions, but you are not able to find where the problem is. So there are chances that you have a cancer. And our medical system is also in such a way that when you visit a facility, they tend to first screen and manage some of the common conditions and the diseases that are easy managed. So unless they are not able to detect this other condition, is when they can think of trying to screen for these malignancies and tumors. But if they maybe get you have this common condition, they will manage and forgetting maybe to screen for these malignancies and cancers in different types of cancer. That making it difficult for or impossible to do an early detection unless you make it a choice and try to ensure that you are safe, because the doctor will only manage what most of the time they can detect very quickly and try to treat that for some time. So maybe if you are doing all that and they have seen that not responding well, if is when they will start thinking about having a cancer. So it is your personal responsibility to ensure that you are safe from these problems. So diagnosis of cancers is normally a combination of different tests, from physical examination to blood tests trying to check for tumor markers like the prostate specific antigen for cancer. We have the beta HCG, quantitative, not qualitative, and others so many tests like the palm smear screening for cervical cancer. So it is a combination of these blood tests and imaging techniques from X-ray, CT scan, MRI, ultrasound, PET, mammography, and also checking on the biopsies, which is the gold standard method of diagnosis. So after scan have indicated that there might be a tumor somewhere, biopsy will be taken to go and confirm if indeed the tumor has developed, is a benign or a malignancy. So biopsy is the gold standard method. The imaging will just give us a picture of the possibility of a tumor developing somewhere. Blood tests will just act like a marker, and most of the time the markers normally help in treatment and management. We have things like endoscopy and some genetic testings also that aid in the diagnosis of cancer. Normally doesn't have a defined cause. That's why it is a global challenge, because there's nothing that you can easily point out that this is what has caused this cancer. And it normally comes in variation. It has different variation, and each and every individual has his own different variation of a specific type of cancer. For example, lung cancer in another person, because of the variation or the variant nature of this cancer, how they quickly mutate and form different genes and variants. That's also why it is also a problem. So when you use a specific type of treatment that target a specific variant, that treatment plan might not cure the other variant. So that is one of the challenges that make it so difficult to manage this condition. When it comes to causes, we only have some of the risk factors that we can associate with cancer. Remember, it arises as a result of mutation in your genes, in the DNA, due to infections in the genes. So some of the risk factors that can cause this kind of infections and mutations include maybe smoking cigarette, alcohol use, having poor diet, you are using a diet that is low in fruits, low in vegetables, you are taking processed food that has a lot of chemicals introducing into your system. So these kind of things are what will get into your DNA and cause this kind of mutation, leading to abnormal growth, cell growth, that will eventually can lead to you developing cancer. You being physically inactive, just there, you don't do much physical exercise, exposure to excessive sunlight and turning bad, especially the UV lights, it's very dangerous, can make you be at a risk of developing cancer. Exposure to chemicals such as pesticides, also a dangerous one. You have to ensure that when you are using these chemicals, you are protected properly. There is no defined age for cancer as much as the elderly, those who are old, as much as they say that they are much at risk, but there is no that defined age, because we have come across cancer in different age group. We have come across cancer in different age group, so there is no that defined age. We have family history also that can be associated with the cancers. We have genetic mutations that you can also check on to find out if you are at risk of developing cancer. We have some specific genetic mutations like BRCA1 and BRCA2. Some cancers are gender specific, like the breast cancer, mostly associated with women, and the prostate cancers, mostly associated with men. So you look at these things and realize that everyone is at risk of developing this cancer, a condition that affects so many people in the world today. So it is important that you initiate some preventive measures to ensure that you are safe and you reduce the risk of you developing cancer. Some of the things that you can do for your safety include avoid smoking, you limit alcohol intake, you eat a balanced diet, and especially processed meat things like sausages. These things, if you eat them too much, they normally have some chemicals that are associated with cancers. You maintain a healthy weight, ensure you check on your weight and you maintain it. You do the necessary physical exercise, workouts and all that to ensure that you have a healthy weight and you are physically fit. You get vaccines where necessary, like for HPV and hepatitis. Reduce exposure to UV light and ensure regular screening, especially for the breast, cervical, prostate and colon, the leading cancers in the world today. So ensure that you do regular screening for them. In terms of management, cancer management and treatment involves a combination of different things, from surgeries where they will remove the tumors after detecting where they are, their condition, and ensuring that removing them won't interfere with other body organs. We have chemotherapy that kills fast growing cells. We have that is for the hormonal dependent cancers, and we have target therapy that attack cancer specific genes, and maybe palliative care, where now we just manage symptoms and offer some support, at least to increase your lifespan. Developed too much that it can't be managed properly. So to avoid getting into those, you need to do some preventive measures. Do early and regular screenings for the common cancers. Manage your diet, reduce smoking and taking these hard drugs and chemicals. Limit alcohol intake, things like that, so that you don't get into such problems or you reduce the risk of you getting cancer. So people living with cancers need some physiological support and counseling, need some healthy lifestyle adjustment. You need to do follow-up screening, manage symptoms, all that. You accept them in the society, you give them some guidance and ensure that their diet is healthy and proper, so that you boost their physical health. Fitness can help a lot. You don't expose them to the risk factors and manage any other symptoms that might be affecting. So generally, Cancer is preventable, and if detected early, it is treatable and manageable. So awareness, screening, and life changes is the key to this. So always stay informed, get screened, and live a healthy life. Inform others, that those around you, those you love, share information on what you know, so that we can help improve life of everyone. Keep tuning and ensure that you hit the subscription button to this channel. Thank you.